Oh, so much to cover. One thing, Princeton saying within the hour that it is expecting the number of students, more than 100, that have self-isolated. They've isolated themselves away from other students. They expect that number to reduce over the next day or two as health officials are able to assess how those students are doing. Meanwhile, in New York City, yes, those 3 patients, one of whom is here at Bellevue Hospital, they're isolated within the hospital. It's certainly a very serious situation. Coronavirus can be deadly, but there are all sorts of reasons not to fear, and here's more as to why. One respiratory illness specialist points out you've probably had the coronavirus before, just not this strain of it. It's called the novel or new coronavirus. Here's the difference between it and ones we've seen and you've probably contracted before.
It's actually the same virus as the common cold, so most of us have been infected with coronavirus at some point in our lives. The thing about this strain is that it's a mutated version of it.
Dr. Purvi Parikh explains why anywhere handling a person who shows symptoms of the virus, like New York Presbyterian and Flushing hospitals in Queens and here at Bellevue, have to take these kinds of measures.
They need to be isolated until they show signs of symptoms dissipating, because we do know that it can be spread from human to human.
At Bellevue, the patient is in a ward that's sealed off from the rest of the hospital, and staff interacting with patients have to wear much more than the surgical masks you've been seeing people wearing around town. It's actually a reminder of why those masks are ineffective. The expert points out just how much.
Ones that you see everywhere, the paper ones, tiny microparticles can still get in.
Even when she has to deal with a patient with a potentially severe respiratory illness, her mask must be airtight, and that's not easy.
If you don't wear the right size, then it's useless. And all of us have to go through this whole thing where they put us in a hood, and it's like a half-hour test to make sure we're wearing the right size.
And she says even that is no guarantee against contracting a respiratory illness like coronavirus, or she says much more likely is the flu, which is much more dangerous than coronavirus at this point. It certainly is more deadly, with 8,000 people having died so far this season in the U.S. alone from the flu. No deaths reported here in the United States. That whole situation at Princeton, we will keep monitoring as it continues to change. And again, university officials expecting the numbers of students, right now over 100, they're expecting that number to reduce significantly in the next day or two as they assess whether or not these students actually have contracted the virus.